Hi, my name is Morgan McDowell, and I'm here today to share with you my poster presentation for the SUNA conference. My poster is on promoting antibiotic stewardship in skilled nursing facilities. This was my DNP scholarly project that I completed at UVA this May. My advisor was Dr. Catherine Reed. The purpose of my scholarly project was to measure the impacts of the use of an SBAR tool utilizing the Loeb criteria on nursing knowledge and urine cultures. This was an EBP project utilizing the Iowa model. Project question for my project was, what is the effect of a formal antibiotic stewardship program that utilizes the Loeb criteria on the impact of nursing knowledge and the number of urine cultures in long-term care facilities? My project design was a pre-test, post-test evaluation of an educational intervention on nursing knowledge, skills, and attitudes. We also utilized a urine culture comparison as well. We utilized 4 skilled nursing facilities located in Southwest Virginia for this project, and we used a convenient sample of nursing staff members there. Unfortunately, given the fact that this project was done during the COVID-19 pandemic, there were a lot of travelers in all of these facilities at the time. Data collection was done pre-test, immediately post-test, and then in a 6 weeks post-test as well. We also looked at urine culture results from 12 weeks after our intervention compared to the same time frame the year prior. Some of our measures included the demographics, and we looked at nursing certification, number of years in nursing, number of total years working in healthcare, number of years in current job, typical shifts worked. And we also utilized a 10-item assessment because we wanted to know more about the nursing knowledge, skills, and attitudes as they related to UTIs, the Loeb criteria, urine collection for culture purposes, which is obviously very important, and the use of the SBAR tool. The sample within our project was 39 folks, which we thought was pretty good considering the time in which we had to do this. So between the 4 facilities there, you can see with the blue bar which facilities had more folks than others. And again, with the pie chart here, you can see participants by their licensure as well. And we had nurses all the way from CNA to master's prepared nurses participate in our educational interventions. So the good news is that we did have a knowledge improvement immediately following the educational intervention, which was statistically significant. So from pre-test scores there, you'll see the mean of 7.37, and then post-test 8.95, which is pretty good. A perfect score would have been a 9 to give you a reference point for the total scores, but we were pleased to find a statistically significant outcome within our study. Unfortunately, though, the knowledge improvement was not fully sustained at 6 weeks. So lots of things at play here, likely given the COVID-19 pandemic, given the high number of travelers in our facilities. And unfortunately, in the middle of the project, it was announced that these facilities were being sold. So we only had a total of 11 participants complete the 6 weeks post-test as well. So that was rather disappointing. Again, slight improvement in the mean value, but this was not considered to be statistically significant for this project. And then the other thing was that there was no statistically significant change to urine cultures. Although there was a large decrease, again, we decreased the total number of urine cultures from all 4 facilities down to 36, which is a pretty big number of drop. Again, many things going on at the time, not COVID-19 pandemic included, transitioning our facilities. A lot of them, unfortunately, became COVID recovery units, so the population changed, and we have to also consider the mortality rates of these facilities and what COVID has done to these facilities as well. So we certainly cannot take the credit for this decrease, but certainly an interesting a pattern there to note. So some summary from the scholarly project included that we did utilize an evidence-based diagnostic criteria. The Loeb criteria has been out for quite some time and is well sourced as a UTI diagnostic tool. All levels of nurses participated in our educational intervention as well, which we thought was really great. We did see some knowledge improvement after participation in the educational intervention. Attitudes about the SBAR did not change, and you can see more of that on the poster. And then the number of cultures were reduced compared to the previous year. However, they were not statistically significant either. I thank you for your time today. I hope you'll get a chance to check out the PDF of the actual poster that I'll be presenting at conference, and I hope to see you there. Thanks so much.